Do you often find yourself setting goals but have a hard time following through? Like you'll set the goal and then you plan to do it, but then you never do it, and then you feel ashamed, so you commit to doing it tomorrow, but tomorrow never comes, and it's like this constant Groundhog's Day where we're constantly setting goals but never being able to reach them? If so, then this video is for you because I'll be talking about some of the strategies that I use as a therapist with my patients to help support them in their likelihood of meeting their goals and their likelihood of success. Hi, welcome to the channel. My name is Parky. I'm a postdoctoral fellow in clinical psychology at Stanford University, and I've been studying and practicing evidence-based mental health for the better part of a decade. Love to share some of that information with you. So one strategy I often find helpful is the use of something I call values clarification, which is helping the patients understand what is truly important to them. Because if there's no why, there's no reason to even start any of the how, because if you don't know why you're doing something, why would you do it in the first place? So my first thing that I often do with patients is help them understand what are the whys of their life, what is truly important to them. So it might be health or family or developing relationships or creativity. Whatever it is for them is helpful to elucidate as to before deciding what their goals are. So if their goals are to be more social or be more healthy, it's important to understand the why underlying being more social. Maybe it means that they can cultivate more relationships, maybe can develop a family, whatever that might be for them. Again, helpful to have the why before the how. So I encourage you to think a little bit more about your whys and what are your values. Why is it important for you to make a change, even though change can sometimes be hard and painful? As Nietzsche once said, a person who has a why can bear almost any how. So another strategy I often find really helpful with patients is the use of a pros and cons list, because it really allows us to systematically identify the benefits and the costs of making a change. Because with any change, there's always benefits and there's always costs. Like for example, let's say you want to work on your social anxiety. There's going to be a lot of pros associated with that, such as spending more time with friends or being more comfortable with strangers or developing romantic relationships. And there's going to be some costs, like it's going to be timely and consuming, it's going to be really anxiety provoking at first, and you're going to feel really uncomfortable. You make other people maybe a little bit more uncomfortable. So there's going to be pros and cons of each, and it's okay to weigh them both and decide afterwards what is truly important to you and what can you make a commitment towards. So a common concept I often introduce to my patient is the concept of effectiveness. And effectiveness comes from dialectical behavior therapy, where essentially it asks the question, are the behaviors that I'm engaging in consistent with my goals? Are they aligned with my goals? And would doing them make it more likely for me to reach my goals? And the thing about effectiveness is that there's never really a truly right behavior in every situation. It always depends on your goal. So you need to be really clear about what your goal is. Because if your goal is to make sure that everybody knows your birthday, then you're going to want to send messages to them every day. You want to shout your birthday out on the top of your lungs to everybody. Whereas if your goal is to actually make sure that people remember your birthday, but also not annoy the living heck out of them, in this case, you might just send a friendly reminder from time to time. So again, effectiveness depends on your goals and the specific behaviors that are most likely to get you towards your goals. So another strategy I often find helpful with patients to increase their likelihood of success is something called SMART goal setting. And what SMART goals stand for is specific, measurable, achievable, relevant, and time bound. So we're really trying to make these big goals like being more social or being more active into something that is actually very specific and very achievable and relevant given what their goals are. So for example, being more active could be something like spending 5 minutes a day doing yoga or doing a 10-minute run every single day. So here we're really making it more granular as to what the specific goal is, and we want to make sure that it's actually achievable for the person who's doing them and setting them, right? Because somebody who hasn't ran in like a year probably shouldn't be setting a marathon every single day for their specific goal. So after I work with my patient to develop some SMART goals, I ask them a question. From a scale of 0 to 10, 0 being not likely at all, to 10 being extremely likely, how likely are you to commit to this exercise and do this thing over the next week? And then I get a sense of how likely they feel like they are, and I get a sense of what obstacles might get in the way. And usually the number I'm looking for is at least a 7, because I really want to set my patients up for success. I don't want to just throw them into the wild and give them another chance to potentially view it as another failure. So I really want to identify what their number is, and if it's like a 5, I will ask them a question like, what would it take you to feel like it would be a 7? And the patient might say something along the lines of, well, I don't know because of X, Y, or Z, and then this gives us a lot of rich information as to what these obstacles can be and allow us to resolve them to increase the likelihood of success. So let's say a patient kind of thinks, I really want to run in the morning, but I'm not sure if I'm going to be able to hear my alarm. What if I snooze it? So our problem solving approach could be, why don't we put your alarm further away so that when it rings, you have to physically get up and close the alarm? And why don't we also put your joggers over there too so that you can put on your shoes and immediately go for the run? How likely would you be in that scenario to go on your run every day in the morning? And in this case, maybe the response will be, well, in this case, it would probably be an 8 on 10. So here I'm like, okay, that feels like a pretty good number. Why don't we go with that? And there can be any number of different obstacles as to why somebody can have a difficulty reaching their goals. It might be they don't remember, they feel too tired, they're too scared, they're not incentivized enough. So it's important to really identify what are your specific barriers, understand why is it hard for you to achieve your goals in a very precise and specific way, whether it's more emotional or psychological, cognitive, whatever the barriers are, you really want to get clear as to what that is, so then you can then choose a very specific technique or strategy to be able to get you towards your goal through addressing that barrier. And when it comes to cognitive behavioral therapy, the CBT model has a really nice way of illustrating that our thoughts, our behaviors, our physical sensations, and our emotions are all intertwined, and they can all influence each other, so that you can change one part of this whole model and then change the entire system. So sometimes even if you don't feel like it, even if you have all these scary thoughts, if you just decide to go with the behavior anyway, do the thing anyway, all these other pieces will change too. So sometimes we can act first and then feel and think second. And remember, the journey of 1,000 miles starts with a single step. So make this first step as easy as possible, as small as possible, so you can build momentum, enjoy the journey, and reach your goals. Otherwise, that's all for this video. If you enjoyed it, I encourage you to subscribe because I'll be continuing to talk more about evidence-based mental health in the future. Take care.